Hi everybody, Dr. Michelle here, and I'm going to talk to you today about pregnancy and nutrition. So specifically supplements. I'm going to tell you about the supplements that I currently take. I am now 28 weeks pregnant with twins, which is very exciting, and my nutritional needs have definitely changed a little bit. First nutritional supplement that I take is a prenatal vitamin, and I specifically chose a prenatal through Douglas Labs and Pure Encapsulations, which is a company that is a health professional grade company, and I do highly recommend whatever supplement company you choose, making sure that it has high quality ingredients and it is a health professional brand. Yes, it's going to be more expensive, but you are going to be actually getting the nutrients that you're paying for, as opposed to if you do go for more of a discount brand, you're not going to be getting as many nutrients in it. So you're going to be getting a lot of fillers, which we obviously don't want. So just make sure you do your research on your company. There are lots of great companies out there, but specifically, like I said, the one I use is called Douglas Labs and Pure Encapsulations. So the prenatal I take is a split prenatal, so I take one in the morning and one at night. And what I really like about this is it splits up the nutrients so you can absorb them, because you really can absorb all of the nutrients in one setting. So it splits them up so your body's better able to absorb them and use them. So I would say the prenatal is similar to like pre-pregnancy or post-pregnancy, like a multivitamin. The other one that I take is an omega-3 or a fish oil. This is super important for babies in terms of their brain development, connective tissue, nervous system, and as well as all of the same for me. It's really good as well for people who have arthritic changes, joint issues. Fish oil really helps to kind of be like a lubrication for the joints. So this is a supplement I took pre-pregnancy, and now that I'm pregnant with twins, I'm actually just doubling it. So instead of taking one a day, I'm taking one in the morning and as well one at night, again splitting it up so that I have the best ability to absorb it. I also take a probiotic, and I also took this pre-pregnancy, but the probiotic I choose is a multi-probiotic, so it has a multi-strain, so your body's better able to use it, and it's going to be more effective for you. And I use it to help with immunity, digestive issues, making sure that my digestive tract is the healthiest possible so it can actually absorb the nutrients that I'm putting into it, which is really great. And when we are pregnant, our immune system is a little bit more depressed than say it would be otherwise. So it just gives me that extra little boost. And again, I took this pre-pregnancy, so really not a huge change during pregnancy. I kept the same dose, just one in the morning with food, and it's going, as well as could be. I haven't really gotten sick, knock on wood, as they say, this season. Maybe a little sniffle here or there, but overall, anything that I have had, I've been able to bounce back super quickly, which is a great sign that my body's doing well and is healthy. And the other supplement I'm taking, is calcium magnesium. Now this is one that I've only added in during pregnancy, and near the beginning of my pregnancy, I was getting calf cramps and muscle cramps, and I had spoken to someone and did a little bit of research and learned that pregnant women can have more muscle cramps due to a lack of calcium and magnesium. So once I added that supplement in, it definitely made a huge difference, and calf cramps went away, which is great. So I add that, and I add that twice a day as well, once in the morning, once at night, again to help with the absorption of the supplement, of the nutrient. And my last vitamin that I take is vitamin D, and vitamin D is an amazing supplement for everyone. It's not something that we get in our society living in London, Ontario in the winter months. We just don't get enough sun. That's just all there is to it. And if we don't get enough sun, we're not getting enough vitamin D. And vitamin D is one of the only vitamins that acts like a hormone in the body, meaning that all of our cells use it. Now, vitamin D is a fat-soluble vitamin, so you do have to be a little bit careful making sure that you don't overdose, but you would need to take a lot to be overdosing. Now, I think the recommended is about 1,000 IU's a day. I take more than that personally, but it is recommended if you are going to be over supplementing, not over supplementing, that's the wrong word, super supplementing, I guess, adding a large amount, that you get a test to know exactly where your levels are at and how much you should have, because you do want to make sure that you are in a safe zone with that. So those are the main supplements that I've been taking. Pre-pregnancy, took omega-3s, probiotics, and vitamin D. Since I became pregnant, I added in a prenatal and a calcium magnesium, and I added extra vitamin D, and I added extra omega. Extra vitamin D mainly because I've been pregnant during the winter months. And I would have added extra anyway, because of the winter months. All of these things are not only helping the babies, because everyone thinks, oh, you're taking these prenatal vitamins so that your babies can get all the nutrients that they need to develop, which is 1,000% yes, we totally want that. But what we're also doing is making sure that mom's body isn't completely depleted of all of her nutrients, because all of the baby, or babies in my case, have taken all of those nutrients. So by keeping my body strong, I'm going to have a better experience being pregnant, number one. And once those babies are delivered, I'm not going to be in such a depleted zone that I'm at higher risk for post-birth complications. So those are my nutrients that I'm taking. The other thing that I will do a video on later that I'm super interested in is the placenta encapsulation, which again is supposed to help the nutrient for the mother post birth. So I'll get more information on that. I'll let you know my experience when I go through with it, but I thought that I might just put that in your mind right now, because if you're pregnant right now, that's something that you might want to look into and think about for another thing to help your body to be the strongest it can be. Because if your body is the strongest and the healthiest it can be, you're going to be able to take care of your baby or babies the best way possible. So I hope this video helps. Hope you got some information from it, and I hope you guys have an awesome rest of your pregnancy, and best of luck. Take care.